Hi, I'm Abhay Gupta. I'm a board-certified plastic surgeon in San Diego, practicing at Gupta Plastic Surgery. Today I'm going to talk about Botox and some of the more common questions I get asked on a daily basis, including some of the misconceptions about Botox. And one thing I'm asked pretty frequently is, how do we dilute our Botox, or do we dilute our Botox here? And it can be confusing if you're not clear about how Botox is delivered to a physician and how it's prepared. Botox isn't really diluted. It's what we call reconstituted. So if you look at a Botox vial, it comes in a box, and it comes in a box of different units. This is 100 units per vial. So in the actual vial, in the box, there's actually 100 units of active toxin ingredient. But if you look at it, it's a powder form. It's an aerosolized powder that sits in there, and it's impossible to inject because there's nothing liquid to drop in a syringe. So Botox in this form, straight out of the box, is impossible to actually treat a patient with. So what you have to do is actually reconstitute it or fill this with some fluid to mix with the Botox powder, so then you can draw it up into a syringe and inject that into a patient for treatment. So it's not truly diluting it because it still stays that the 100 units are still there, but you're mixing them with fluid, which would then fill in the vial, and now I can draw the fluid out into a syringe and inject that into a patient for treatment. So the real question is to ask the physician is, how do they reconstitute their Botox, or what concentration do they end up having in a syringe of Botox? So that depends on how much fluid you inject into the vial of the 100 units. For example, here in my office, I typically use 4 cc's of saline to fill the vial. So therefore, you have 4 cc's mixing with the 100 units of the toxin. So at the end result, each cc has 25 units of Botox ingredient, actual Botox active toxin. So that's what we use then to calculate how much Botox is injected in the patient. Typically for Botox, we put in between 2 to 5 units per injection site per muscle treated. So total area treated might be 10 to 15 units, for example, to treat a muscle in 2 or 3 different locations. Now, normally if you're going to a surgeon and ask how much Botox they use, they could tell you the number of units they use based on how much fluid they're injecting. So if I take a 1 cc syringe, which has the 25 units of Botox, and I inject that all into the face in different locations, you know I've delivered 25 units of Botox. And here in Gupta Plastic Surgery, that's how we charge our patients, by the unit. Some practices you'll see will charge by the area. For example, they'll charge you X amount of dollars for the forehead or for the eyes, for the crow's feet. Makes pricing simpler, calculation simpler, but you're not really sure how many units they've actually injected into you, because they could inject 5 units in the area, they could inject 15 units in the area. And if you pay the same amount of price for both, you may be overpaying for the Botox. So that's how Botox is prepared, that's how Botox is delivered. What does Botox do? How does it actually work? It's a toxin. It's a toxin released by the botulism organism, and it actually paralyzes or weakens muscles in small enough doses. So what we do is we deliver the Botox into a muscle that's pulling on the skin and therefore causing a crease. So if we weaken that muscle, it's not going to pull on the skin. It's not going to create that crease, and therefore you'll get some flattening. Another misconception is that Botox will help treat deeper creases, such as the creases that form in the cheek area and the marionette lines or the jowls. Botox doesn't do that. Those muscles are those creases and folds are created by different types of aging changes, which I've discussed in another video on the site. And Botox would only work on the more superficial muscles that create wrinkles, such as the ones around the eyes, the ones in the forehead, and the ones in between the eyes, the glabella. So when Botox is injected into those muscles, they weaken and you don't form the creases. Now, if the crease is there already, if somebody comes in and they have a deep crease in the middle of their forehead because that skin has been aged for a longer time, Botox will prevent the muscles from making the crease any deeper, so they can't do that. But if the crease is there at rest when the muscle's not moving, then that crease won't get improved by Botox injection. In that case, what you have to do is actually fill the crease with something, with like a filler, such as Juvederm, which is a filling substance, and you can put that in there and fill the crease and make it much fuller. So Botox does have limited applications, but when used in the right concentrations, the right amounts, and in the right locations, has very good results. I hope that answered some of the the myths out there about Botox, and I encourage you to check out the other videos on our website at guptaplasticsurgery.com. Thanks very much.